Hi, welcome to Gatherverse. My name is Carl Lorenzo McIver, and I represent three brands: Red, Bloodless Medicine and Surgery, the Nursing Ecosystem, and Metaverse. That's MEDI verse. Well, I'm proud of these three brands because I know that they're going to bring something to, I like to call, the mainstream public. Or rather than say patient, consumer. Because right now, there's been a paradigm shift. Maybe in years past, the patient may have had little, probably, ability to really be heard. But today is different. Today, there's research that consumers are able to find on their own, whether on the internet, social media, as well as to make decisions that they were maybe unable to make in the past or may not have had the information afforded to them. So with that being said, here to bring this medicine or to bring clinicians or to bring researchers, anesthesiologists, surgeons, doctors, nurses, perfusionists, I hope I didn't leave anyone out, into this new environment called the metaverse, well, that's going to be a challenge, but an exciting one. I hope that my talk will not only bring everyone interest, but also to really see maybe change our thinking, as a word, to look at this as a wonderful tool to be able to better to engage, to be able to evaluate our various habits, and to share information with one another. Well, first, I'd like to just give some idea of what the metaverse really is. Now, trust me, there are people on these various sessions throughout Gatherverse that can do a much better job. But I'm going to try to do it a little simple and at least the best of my understanding. The metaverse, to me, is just like if you had the ability to have a planet of your own. And someone said to you, here's your planet. You can do pretty much what you like, which means you can develop any type of infrastructure. You can develop any type of theme. Any type of a wealth of information can be shared on that planet. It really is up to you. Well, that's what the metaverse is for me. I wanted to build an infrastructure centered around medicine, but particularly bloodless medicine and surgery. As well, on this planet I call the Metaverse, MEDI verse, to have opportunities for nurses to be there and to have ownership of something where those that may want to have that entrepreneur spirit really brought out in them. Maybe that's their heart, maybe their own business, own their own business, or maybe to be able to teach others in the nursing arena. And maybe those that are bedside want the opportunity to just expand their ability to chat with one another, maybe to share ideas, or just it may be something where right now we know our nurses are going through so much emotionally that it could be something of a comfort, just that metaverse, that environment. But before I get into that, I think you need to know a little bit about me. Because when you look at someone and they're creating something, you want to know what their passion is. What motivated them to think of maybe opportunities, and maybe not only for themselves, but for others. So I want to share a little bit about me. I think that will give you a little insight on why bloodless medicine and surgery is dear to me, but even so, why nursing is dear as well. But I'll give you a little hint why nurses are dear to me. When I started the brand of Bloodless Medicine and Surgery, I remember back, I didn't really have many, I'd say, connections. And you ever have that on LinkedIn where it'll say pending for such a long period of time? Well, that was me. And you become depressed. You wonder, well, do I have a message that's engaging? Am I putting out something that's of any importance? And I do remember when I started to engage with those in nursing, it was so encouraging because not only were they supportive, and I'm talking about over years, but individual nurses Nurses as a group globally supported the brand with loyalty. And I said to myself, that type of loyalty I personally would never forget. And if I ever had an opportunity to develop an infrastructure, I definitely wanted to include nursing. I know one of the things that I did was to develop what we call the nursing ecosystem. And the nursing ecosystem, I felt, was such an appropriate term or title, especially now with the introduction of the Metaverse. Now, keep in mind, I mentioned or I developed the nursing ecosystem long before the Metaverse. But isn't it appropriate? Because I felt, why should nursing or nurses be strapped with something called the field if the innovations that they're engaging in, they're being heard, they're developing, I guess, brands of their own? Wouldn't that better fall under an ecosystem rather than a field? And not only that, but I felt the field had such negative connotations. When you think about the field, you think about maybe being encapsulated. You think about probably fences that don't allow you to be able to expand. Well, sad to say for some, that may define nursing. But we hope the nursing ecosystem as a term, as an environment, will encourage nurses to be able to have the freedom to be able to be themselves. Well, first, let me tell you a little bit about me. Well, I actually grew up in Brooklyn. I was born in Brooklyn. And then my parents moved to the Bronx. And we were there for quite a while, actually, until I married. Now, through that, from me being a child and growing up as a teenager, I became one of Jehovah's Witnesses. And I was so glad. It really gave me nice structure. I had the opportunity to travel and meet other friends in different countries and learn a lot. One of the things that probably stand out to everyone is that Jehovah's Witnesses abstain from blood. But that's a personal decision, and that was my personal decision based on my Bible research. But one of the things I really appreciate about the medical field, even though this little niche group had their wishes to abstain from blood, we can see that the medical field did all that they could to develop various types of protocols, various types of innovations that satisfied that need. One, I think, me personally, the most unfortunate things started to occur was that it was almost a blood versus acceptance of blood. And I never really understood that personally, because really, those are just two different decisions. It's almost like this. What if you personally liked ice cream on a cone? And I liked ice cream in a dish. Well, we could spend decades trying to find research to decide which one is better. But technically, at the end of the day, aren't we both enjoying our ice cream treats? Because those are the decisions we personally made. Well, to me, it was no different when it came to blood. Some individuals may decide that they want a blood transfusion. That's their decision. Where others decide that they wanted to abstain. That's their decision. So one, there's no data that should prove one better than the other because it's a person's personal decision. As a patient, but I like to say as a consumer, because as consumers, don't we have decisions that we personally make? I don't have to go to a hospital that's down the block. I can go to a hospital that's a little further. It's just my personal decision. Well, today I started to think about that whole process, even the process of having what we call a no blood card. I never really understood that to a certain degree, because here you have to show a card that says no blood when you're being serviced at a hospital. Well, let me ask you a question. If I were to go to your home for dinner and I said to you, I am allergic to peanuts, I would have to think that your family would do all they can to make sure there weren't any peanuts in your home. So my family arrives and we greet each other. And then I have to pull out a big sign saying, I am allergic to peanuts, no peanuts. What kind of trust then do I have in you as a host? Now you begin to see why I developed Bloodless Medicine and Surgery as a brand. For years, there was no identity. Now think about this, 30 years of hospitals, medical centers, researchers, developing all types of data, evidence-based materials on the value, the efficacy, but there was never a brand. Now, here's another thing. All this information regarding Bloodless, the research, was really shared between the clinicians, let's say the medical centers, and maybe the small niche of individuals, which satisfied their needs. Wait a minute. There's a whole mainstream group of individuals globally that may not have been gifted with this wonderful gift of bloodless medicine and surgery. So, Bloodless Medicine and Surgery as a brand is here to bring awareness to the mainstream, to really bring these wonderful protocols that already exists in hospitals. And that's not leaving out the many manufacturing companies that have developed surgical tools, instruments that go along with that process. So what Bloodless Medicine and Surgery as a brand does, it harnesses all these various, we'll say, institutions, innovators, doctors, surgeons, nurses, perfusionists, anesthesiologists, bloodless programs, bloodless medicine hospitals, institutions, colleges, and brings it under one branding system where now you, as a consumer, can better identify. And we're doing this globally. And it's had such, I'd say, success. Because I really didn't know personally how many individuals were unfamiliar with bloodless medicine and surgery. Now, here's another thing. Sometimes clinicians, or we'll say the medical field, it's very difficult to speak the language of mainstream. Here's what I mean. I hope that Bloodless Medicine and Surgery, the brand, is able to better engage with, we'll call it, different populations of people. And by engaging and by developing posts and different types of visuals and developing a branding system that could be identified with, why, you'll be able to make better decisions. It won't be difficult. And isn't that what we want in life? To be able to have situations or to be placed in a situation where we can make better decisions. Technically, all of my brands need to be in the metaverse. Here's why. Bloodless Medicine and Surgery, before COVID, hospitals, bloodless medicine and surgery programs, and associations were able to have large-scale meetings and be able to share what we could call content. Since COVID and since the pandemic, that has slowed down a great deal. So when communication and engagement comes to a slowdown, then what happens? A larger gap forms. Well, we can't afford that gap, especially with all the innovation that's taken place in this area of bloodless medicine and surgery, especially now when we're dealing with a blood crisis. Well, here's the answer. The metaverse and what we're developing in Metaverse suites will be environments where hospitals, bloodless programs will be able to have meetings. Now, these are virtual meetings. And here, people will be represented by their avatars, where the avatars will be able to meet maybe in a room privately, where you can have large-scale audiences, where content can be shared. And actually, it almost becomes a little better than the traditional face-to-face meetings. Now, graphics, 3D graphics can be developed where the different complexities of operations really can be shown. There's already surgeons and doctors that are using VR technology by illustrating various surgeries. We welcome them aboard. There's a wonderful collaborative effort here to be able to not only develop this wonderful platform within the metaverse, but to, let's say, bring up the scale of our ability to be able to share complex content. We're now going to be simple, where now the mainstream could be able to now have better engagement with the clinicians. That's our goal for the metaverse and bloodless medicine and surgery. Now for our nurses. The nurses now could be able to have ownership of something. Can you imagine now the nurse that may want to develop her own or his business and wants to become an entrepreneur? Well, now here's the opportunity. You can be able to have a metaverse suite that's definitely affordable. And in some cases, we're talking in terms of companies that may be sponsoring some suites for many of our nurses. What a wonderful program that'll be. So we're really trying our best, Bloodless Medicine and Surgery, the nursing ecosystem, to develop this environment where now nurses, doctors, anyone in the medical field could be able to not only be able to share content, but have ownership. Have ownership where now they can be able to, let's say, become a better stewards in medicine. Isn't that something that we all want? Well, we hope that you'll support Bloodless Medicine and Surgery, the nursing ecosystem, and especially the metaverse suites. And by doing that, well, it's like an investment into medicine. We'll see you in the metaverse. Thank you.